Hi, greetings from International Institute of Distance Learning, the academic division of National Association of Palliative Care for Ayush and Integrative Medicine. I am Dr. Piyush Gupta, Secretary of National Association of Palliative Care for Ayush and Integrative Medicine and Secretary and Principal Executive Officer of Cancer Aid Society. So, in this presentation, we will be talking about essential narcotic drugs and advocacy. So, first of all, let us understand what is the meaning of essential narcotic drugs. So, before 2015, according to Narcotic Drugs and Psychotropic Substances Act, so all those drugs were part of NDPS Act and which includes morphine also, opium, morphine and other narcotic drugs, and possession of these drugs needed a license, and it was very difficult to get the license even for oral morphine, which is the World Health Organization's gold standard for treatment of pain of the cancer patients. After 2015, some of the medicines which we will be explaining later, which are used for treatment of cancer pain, were brought out from that act, and we already know that license of narcotic drugs is given by excise officials, whereas these medicines for treating the pain of the patient, they were brought out from the purview of Narcotic Drugs and Psychotropic Substances Act. From excise department, its license was now to be issued by drug controller of the state, and we all know that drug controller gives license for medicines, etc. So, it is easier for people to get license from drug controller, and it was very difficult in getting licenses from the excise department, which normally gives licenses for things like alcohol. So, in 2015, these drugs which were used for treatment of cancer pain, they were called as essential narcotic drugs, and we will be talking about these as well as how we can get its availability, about the license procedure, and after availability how we have to maintain the records. So, that all we will be understanding in this presentation. Now, next word is advocacy. So, what do you understand by the term advocacy? So, normally we know what advocates do. They fight for your cause with the judge. They put your cause before the judge. So, similarly, the issues which are for others, which are social concerns. So, you have to get up, you have to rise to the occasion and sensitize others about those issues. And one very important issue is treating the pain of the patients, because most patients, they suffer from tremendous pain and they curse themselves for none of their sins. They ask the God to take their lives early, but they have not done any crime. They are suffering from a disease and their pain is very much treatable, but since the medication which can treat their pain, it is covered under NDPS Act, hence their pain is distant from being treated. So, you have to understand that after attending this presentation, it is not only for reading, but you have to become an advocate. You have to sensitize the government and other officials and even the doctors that they should not ignore the pain of the patients. They should learn to address the pain of the patients, and let us say oral morphine is very important for treating their pain, and if it is not available in the market, neither it is available in their hospitals, then what happens? Even if you want to use it, you cannot use it. So, availability of oral morphine, you have to advocate in the government hospitals, you have to advocate in the private hospitals that they should bring this tablet, which hardly costs 2 rupees, and rather than getting a tablet of 2 rupees, people shell thousands and thousands of rupees just for treating their pain, and which again is not treated properly. So, remember, we have to ensure that oral morphine becomes available across the country, at least in government hospitals and some private hospitals who have palliative care professionals working with them. So, you will have to sensitize those government hospitals, train them onto the issues of availability of oral morphine. Sometimes even the licensing authorities may not be aware about the new rules. So, you will purchase the NDPS amended act of 2015 and you will show them the chapter 5B, which covers about the essential narcotic drugs, and you can refer. We will be covering in this presentation about the various sections, various forms, and you can use it as a guidance and you can show it to the competent authorities, and that is how once you make the oral morphine available across the country, really you will be treating the pain of the people who are in deep anguish and who curse themselves for none of their sins. So, let us carry on with this. We have to again understand that by 2030 we have to achieve these 17 goals which were drafted by United Nations Sustainable Development Goals, and all the UN members were signatories to this. Here we can see that goal number 3 is good health and well-being. So, when we are talking about sustainable development goals, goal number 3, good health and well-being. Now, good health aims to keep the global citizens healthy as well as disease free. But what do we understand by the term well-being? Now, this points towards palliative care, and what is palliative care? You must be knowing by now. Taking care about the sufferings of the people due to various illnesses and improving their quality of life. And one very important symptom which is often ignored by the doctors, by the family and friends, is pain. Remember, this pain is treatable, but most of the time we learn to stay with the pain rather than getting it treatable. So, you have to tell all those people who are suffering in pain that their pain can be treated and they should go to a palliative care doctor who will treat their pain, because normal doctors who are treating the cancer, they do not have time to address to the other symptoms of the patients, and many times these patients are into deep anguish due to severe pain, which could be physical pain or it could be mental pain too, along with social, psychological and spiritual issues, and this is possible only by a palliative care professional to address the various pain of the patient. So, here you can see me participating in the high level meetings on NCDs at United Nations in 2011, and subsequent review meeting in 2014, and that was starting of the fight against non-communicable diseases globally. So, well, I was organizing secretary of 18th International Conference of Indian Association of Palliative Care at Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow. And after that, in 2015 April, I had participated at World Health Organization headquarters Geneva on the meeting of Global Coordination Mechanism on Non-Communicable Diseases. This was the second meeting at WHO Geneva headquarters in November 2015, and you can see me attending the meeting and getting engaged in the dialogue over here. And this is the representation of Cancer Aid Society within UN WHO office at Geneva. So, when we are talking about global morphine consumption, you can see the graph, and here we can see that there are countries who are on top using the maximum morphine, and you can find India, which is having the largest population of the country, hardly using any morphine. This shows that our patients are in tremendous pain. Now, this is the slide where we are seeing that down the line morphine consumption is using across the world, but nothing has improved in India. So, let us see the morphine consumption in India from 1985 to 1995, and we see all of a sudden this graph is going down. So, we were using morphine effectively, but down the line it is going to the bare minimal position. What are the reasons for this decline in morphine usage? So, the complexity of Narcotic Drugs and Psychotropic Substances Act 1985, along with the international conventions, it made availability of oral morphine very, very complicated. Different states framed different rules, and there were multiple licensing systems for possession, export, import involving excise along with drug controller. Now, to address the above problem at national level, Cancer Aid Society got involved in effective advocacy, and this was under the grant of American Cancer Society. So, we organized 33 workshops on palliative care and oral morphine since 2007 to 2019 in various government medical colleges, regional cancer centers in the states of UP, MP, Bihar, Jharkhand, Chhattisgarh, Assam, Punjab and Tamil Nadu. We created an environment for starting of pain clinics and availability of oral morphine, and the effort continues even till date. We organize CME in pain management for final year MBBS students of various medical colleges in collaboration with SGPGIMS Anesthesia Department. We got involved in advocacy for implementing directives of Honorable Supreme Court dated 24/8/2012 to the state governments for making oral morphine available for treating the pain of terminally ill cancer patients. As I told you, we organized the 18th International Conference of IAPC, and here we announced ₹1 lakh annual award for leadership in palliative care amongst our countries. So, that was the first ever international award announced by Cancer Aid Society. We drafted a palliative care declaration, the first declaration across the globe in 2011. We provided financial assistance towards palliative care to over 2,200 more patients. We have contributed in amendment of NDPS Act, and on behalf of Cancer Aid Society, I was member of the committee for suggesting the changes in NDPS Act. So, you can see we have organized workshops in the various institutions across the country, and this even continues till date. So, there is a huge list of our workshops. We have trained thousands of doctors in palliative care as well as oral morphine, which has benefited lakhs of patients and created compatible atmosphere in North India, because earlier this palliative care was confined only to the state of Kerala, and Cancer Aid Society with its initiative brought it across North India. So, on the eve of IPCON 2011, MCI announced MD course in palliative medicine, which was the long standing demand of palliative care professionals. The chairman MCI in his message to Cancer Aid Society suggested us to come out with practical strategies which could be affected by the council in the coming times, and his goodwill shows the improvements in palliative care. Debate in IPCON 2011 was on euthanasia is human care in face of suffering, and in March Honorable Supreme Court legalized passive euthanasia, which we all know was widely covered across the country in newspapers. Honorable Supreme Court on 24th of August 2012 directed the chief secretaries of state governments to make morphine preparations available for treating the pain of terminally ill patients. Now, after achieving the above goal, we stand committed for its implementation across the country by taking it once again with the state governments and improve the availability of oral morphine, thereby taking away the pain of the cancer patients. And for your information, Cancer Aid Society has got lead grant of International Association of Palliative Care for the year 22, 23, 24 and 24, 25 for achieving this goal. Here you can see that our advocacy during NDPS Amendment Act with the various state governments, because being a subject of state as well as center, the state government's recommendations were very important for amendment of NDPS Act, and this was delegated to us, which we had effectively covered. So, our letter to the Prime Minister was forwarded to the Finance Ministry and resulted in the amendment of the NDPS Act, where we were one of the committee members for finalizing the changes, so as to improve the availability of oral morphine and other essential drugs for improving the palliative care services across the country. So, here you can see what we had done in our advocacy across the country. This is Times of India, which has quoted it in a big way. And in UP, we have a UP model, where the excise commissioner, he simply sent a letter to all his subordinates for giving licenses to the government medical colleges and hospitals without fail, and this had simplified the entire thing in UP in a big way. So, this is, we had sent a letter to Prime Minister office, which was forwarded to the NDPS Amendment Act committee, and you can see that after this we were invited to be a party for the amendment of NDPS Act, and here you can find me a part of the committee. We had deliberations, and finally, the act was amended in 2015. It was notified, and in spite of notification, things have not improved because of lack of sensitization. Most of the government officials are not aware about the amended act, and they are still following the old rules. So, we have to sensitize others for the availability of oral morphine, and this is known as advocacy. In this amended act, licensing for the chemist was not very clear. So, we wrote a letter to the Directorate General of Health Services, and you can find that they had replied to our letter, and they have clarified the issues related with licensing of chemists. Now, what are essential narcotic drugs? According to the amended NDPS Act, the essential narcotic drugs, the license has to be issued by drug controller and not excise department. So, morphine, codeine, oxycodone, hydrocodone and fentanyl, these are the essential narcotic drugs which are used for treating the pain of the patients. Now, when we are talking about licensing of oral morphine, some of the norms for its record keeping are very important and we will be covering those norms. So, kindly be very attentive and listen this. So, first of all those institutions who get license, they are known as recognized medical institutions, and this you can cover in NDPS Act chapter 5B. If you want, you can refer to that act. Now, section 52N says that one registered medical practitioner with degree in medicine, dentistry and training in pain and relief and palliative care is important. Now, government hospitals are deemed RMIs and they are exempted from application for RMI. However, all other provisions shall apply. Section 52O says for application of RMI, renewal in form 3F has to be done to the drug controller. So, earlier in some states it was excise controller, in some states it was excise as well as drug controller. So, there was mixture of rules being followed in different states, but after the amendment all states have to follow the central rule, and certificate of recognition in form 3G has to be issued within 60 days or they have to give the reasons for delay has to be given by the drug controller. So, here we can see the copy of form number 3F, which is application for issue renewal of certificate of recognition as recognized medical institution. And we are here, form number 3G is the certificate of recognition under NDPS Act for license of essential narcotic drugs. Section 52R, it covers the duties of registered medical practitioner and maintain following records for 2 years. Now, patient record is maintained in form 3E, receipt and disbursement record is maintained in form 3H. So, we can see this is form 3E and this is form 3H. Now, section 52R explains about the duties of registered medical practitioner, and he has to file return before 31st of March in form 3I. Section 52T, this covers about the next year's estimate by 30th of November in form 3J, it has to be submitted, and in case the requirement exceeds the annual estimate, then revised estimate to be given before 31st of August of the same year with brief justification why it has to be increased, and it has to be filed in return form 3I. So, here we can see the extracts of form 3J and form 3I, where you are asking for increased demand for oral morphine and other essential narcotic drugs. So, what is basically goal of advocacy in palliative care? So, one thing is education, which already you are into. Next part is that after getting educated, how you are going to use essential narcotic drugs, especially oral morphine. Now, availability of oral morphine is very important, and for this you have to sensitize the government officials regarding the amended NDPS Act 2015, because right now it is not being followed and implemented. So, you will help in implementation. What is the take home message? Concept of total pain as whole family suffers, not only the patient itself. oral morphine is mainstay of cancer pain management, but advocacy is required for its availability, because you will not find it available easily in all across the country other than Kerala. Licensing for essential narcotic drugs is now given by drug controller in all the states to the recognized medical institutions. Government hospitals are deemed as recognized medical institutions. That means, they have to be given licenses without following the conditions of RMI, but again all record keeping and all other procedures after licensing has to be done by all the government hospitals. So, Cancer Aid Society is an ISO 9001 NGO having a special consultative status with United Nations Economic and Social Council. We are working in association with Department of Global Communications of United Nations. We are member of World Health Organization's Global Coordination Mechanism for Non-Communicable Diseases, and we have several awards to our credit, like Best NGO in Healthcare, Best Cancer Awareness NGO, etc. Thank you. Have a great day ahead.